surgery. So we have a very interesting case. This is a nice patient who got implants in 2009 initially, and then there's no operative report, but according to the patient, they had to replace the implant right during the surgery. And then she ended up getting a replacement in 2014, so that would be her third set of implants. So 2014 silicone. So she came to me with what is a grade 3 capsular contracture on the right below the muscle. She had a full lift, lollipop anchor lift on the right and also on the left. And she had a grade 4 capsular contracture on the left, which is where the capsule was super tight and hard and basically causing pain on the left side. That's what made it a grade 4 versus grade 3 on the right, hard and distorting the chest. So as you will see on this right side, I cut out the excess skin here. This is the scar tissue as well to help with the contouring. And as you will see, look at the way this looks flat over here. The entirety of the implant capsule has been removed, and if you look carefully, you will see what is the ethibond suture, which is this permanent braided green suture here, 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 and a lot of scar tissue. If you look carefully over here, you can see this is the cartilage part of the rib, and this is right on top, suturing and basically anchoring this in. So I'm going to go ahead and go in from there. So the ethibond suture, scar tissue, anything inflamed, irregular was removed. That felt bad, looked bad, palpated bad. And as I go in, you'll see implants from 2014, very hard capsule. And as I go in, this is relatively very thin capsule. So underneath the muscle, very involved, relatively small implant, 225 according to the card that the patient had. And these are my new gloves, and you can see small implant, and there's some fluid on the back. So if I go like this, look at that. This is your bleaching of the silicone, very slimy. And look at the way the implant is sitting. It's been sitting like that for many years, like compressed on itself. So intact implant, intact. And this is your Mentor 225, just like the card says. And what I would say, gummy bear, nice condition. And over here you will see the capsular tissue, some so small, some you can see how thin this is. If I put it on top of a ruler, you can read the numbers. No matter how thin it is removed. Now the other thing I want to show here is, look at this green suture, and I'm going to just show you. It's a braided suture that is in the proximity of the implant right here. As you can see, it's very hard. I'm going to go ahead and remove it. So that in itself, foreign material. I don't like this in the proximity of the implant, and you can see it can rub against. Any of this foreign material was also removed completely, definitively, such that there is no foreign material burden left behind. And this tissue around behind, as you can see, is very thick scar tissue. So all of this will be going to pathology. So I'm going to go ahead and now remove my top sterile glove, and I have a sterile glove at the bottom. Now when I was dissecting the left side, which is the grade 4 capsular contracture, overall surgery went very well. Very pleased with how everything was sitting. And as you will see, this is the part, this is the muscle on top, and a lot of inflammation. There is this one very small hole, as you will see right here. This is the part that was stuck right onto the rib. You can see the imprint of that cartilage part of the rib. You can see the suture material here, green ethibond. But if you look at this small hole, this is what I did. I took a sponge and I basically plugged it such that none of it spilled into the chest. So no silicone spilled into the chest, no need for drains, and no abnormal tissue, no inflamed tissue left behind. And so it was essentially plugged. And so as you will see, everything done in a very controlled, nice fashion. You can see kind of there is an apex to this. And so what I'm going to do is, if I try to pull this up, you can see it is stuck. And you can also see that it is indeed very much ruptured. Now I leave the hardest part till the very end. And so as I go in and I cut this out, you will see this is indeed what is a ruptured implant. And you can see, look how transparent thin this is, and the proximity of this is actually the dissection hole right here, like maybe 2.5 millimeters or so. And this shows you that this is certainly not truly intact, and there is all contained, none of the silicone spilled in the chest, no need for drains. And look at the difference between the two implants. And so if I go in, you will see, again, look how thin, literally how thin the capsular tissue is. No matter how thin it is, the whole surgery was done in a very thoughtful, contained way, such that all of the implant capsule was removed in a very defined, sincere way without any of the silicone spilling into the chest, as you can see. So ethicon suture removed, implant capsule all removed. You know, the one question that one of the other patients was making a medical comment on, and I'm sure she's not a medical doctor or a surgeon, because all the inflamed tissue is removed, because all of that capsular tissue is removed, because this dissection is done in a very nice, sincere way, the need for the drain is not there, period. Not only there are many other surgeons who are now starting to do explants without the need for the drains. That in itself tells me that the surgery was done right. If a surgeon is using drains, in my experience, from my assessment, having removed thousands of these explants, the need for the drain kind of validates, reinforces, confirms, or authenticates that no badness was left behind, and that there is no need for the drain. And this is where post-op, as you will see, not only this patient, but many thousands of the others did not need drains, to the point where I have not needed drains in well 5.5 years. And when it comes to compression, compression is very much part of any plastic surgery procedure, be it the tummy tuck, be it the arm lift, thigh lift, gynecomastia surgery. This is where compression is where it is mandatory. It is malpractice if you do a tummy tuck and not to use the compression garments post-op for approximately 6 weeks plus minus. So there you have it. This is like the con procedure. The implants will be returned to the patient, capsules to be sent to pathology, rule out the BIALCL CD30 analysis, rule out lymphoma, rule out malignancy, cultures for aerobic, anaerobic, and fungal. That's number 3. Number 4, no need for a lift, no need for drains. Number 6, Twyback deep sedation. Number 7, no matter what, the patient gets the same surgery regardless of her underlying comorbidities. And so this is where it tells you that this is a very systematic, thoughtful way from one patient to the next, so that the patient has that complete peace of mind that the surgery was done in the manner described. She's going to get the high definition pictures and videos, not only of this cutting open, but most importantly, the high definition pictures and videos of the chest wall showing complete removal of the capsule on the chest wall, because that is the ultimate and the only way to confirm visually, objectively, that the surgery was done in the manner it was. And there's no HIPAA violation in taking your own pictures and videos and showing it to the same patient. And so that is certainly very much, if you ask me, in the case of explants, the true and the right way to show that it was done in the manner described. So there you have it. This is Dr. Khan, Executive Plastic Surgery.